So here I have my tray set up for doing a Botox session, and I'll go through the different items we have. The first is the most important. This is our handheld EMG. EMG is electromyography, and the best thing about an EMG is you can confirm that the needle tip is actually in the muscle just by attaching some electrodes here. Turn. Good. So the first thing we do is attach our needle, and that's in place. And then we actually have some grounding pads. And so on both of these areas, they go onto the top. And then the grounding pads actually will go to the area on the patient that I'm treating. And then I'm going to attach some Botox to the end of this needle. So the needle actually has a hole in the end, so it can introduce medication through the tip directly into the muscle. This is a very small syringe that we like to use. It's not used in many areas of medicine, but this is great because Botox dosing is very specific and we need to get it down to a micro amount and keep track of that. So what we do next is we attach the needle to the tip and then we draw it up. Now I have a team that helps me with reconstituting Botox.
So we use a 1 ml, really teeny tiny syringe with a very long, teeny tiny needle. This is our Botox vial. This is a 200 unit. This is a 100 unit. This is our normal saline that we do the reconstitution. These come in, these vials here, and it's a powder form. So we do the draw up, and we don't touch the tops of these ever. So we draw up, and we put 2 mLs into the 200. And remove the syringe. And we swish. We do not pick it up. We do not shake it. You do not want bubbles. This is what we consider liquid gold. Once that is finished, now we're going to draw it up. We tilt it. Do not touch the top. And that's a perfect 1 ml that's been drawn up.
And we have Botox here. So these are very expensive vials of Botox. This is called liquid gold. So we place that onto the tray, and depending on how much I'm injecting into the patient, I would prepare multiple vials of this if necessary. So now we're prepared to do our Botox. So the next thing we're gonna do is attach our liquid gold to the needle. And now we're ready to inject the patient. And so I'm gonna turn on the device next. And then after confirming the muscle I wanna be in, I would place that needle into the patient, and then I can turn on the EMG to hear some different sounds. And through training, there's a lot of different sounds I'm looking for to confirm that I'm in the right muscle. The other setting I can use is to stimulate the muscle and see if I'm moving it in a correct position. That's good. So we're right in that muscle where I want to be since we're sending that our normal movement. That's exactly what I want to see when the needle tip is in the correct muscle for thumb tightness. After I'm done with the Botox, everything is discarded and the patient is left home without any restrictions and they're comfortable.